Hello, everyone. Now we're deep into the next stages of Module 7. What I'd like to do today is talk to you a little bit more about some of the connections between the Precede-Proceed model and what's known as the Re-AIM framework. The Re-AIM framework was derived from a multitude of implementation science methods, including the division of innovation theory and also the Precede-Proceed model, which has been the focus of Module 7. What I'd like to do right now is talk a little bit more about exactly what is the Re-AIM framework. So what's important to think about is what exactly do we mean when we talk about the planning and evaluation of our intervention strategies? In what ways can we translate the evidence base into policy and into practice? And this is where the Re-AIM framework becomes helpful. We want to think about reach, effectiveness, adoption, implementation, and maintenance. So when we say reach, what we're talking about is at the individual level, the absolute number, quantity, and representativeness of individuals who are willing to participate in a given initiative, intervention, or program, and also the reasons why or why not they may want to participate. You also want to think about effectiveness at the individual level. What is the impact of your intervention on important individual outcomes, such as potential negative effects or a positive broader impact to quality of life and economic outcomes? Adoption means multiple settings and staff levels. So what's the absolute proportion or representativeness of the settings that you're seeking to embed the program into? So think of it this way. Would you need to nest or build multiple levels of staff in a hospital clinic, a school, or some other system within a community? When you think about implementation, this is multiple settings and also delivery of staff in multiple settings. So you want to think about the intended time and cost of the implementation. In what ways might you need to adapt your intervention in terms of looking at how this can cause feasible results? So the type, timing, and reasons that adaptations are made is especially important in this context for implementation. You also want to think about maintenance. Once your program or policy has actually become institutionalized or part of a routine practice, you want to look at the individual level in terms of how maintenance has been defined in terms of long-term effects of your program after the program has been completed. So this will be your specific time frame for assessing maintenance and sustainability across the project. And so the reason why the Re-AIM framework can be helpful is when you think about the Precede-Proceed model, and specifically looking at the idea in terms of components, criteria, and measures, in terms of the work that we do in clinical and community organizations, this can be a useful alternative to evaluate the public health impact of our work. So you really want to think about the Re-AIM framework in terms of what ways you might want to quantify or possibly have some statistics to look at exactly who was intended to benefit and who actually participated, who was exposed to your intervention. Again, this is the reach component. You want to look at what were the most important benefits that you were trying to achieve and what was the likelihood of negative outcomes. That's going to be the what, also known as your effectiveness. In what ways was the program or your policy applied and who applied it? This will be your adoption phase. You really want to think about here in terms of organizational priorities and existing workflow for your staff. And then also, how consistently was the program or policy delivered? And what adaptations might need to be made to the original plan? Also, how much did it cost? So these how components deal with the implementation component. And finally, to sum it up, when did the initiative become fully operational? How long did the results last? And how long was your initiative sustained? These are all aspects of when. And this is specifically related to the maintenance component. So as an overarching framework, you want to think about in what ways that your program may have impact. Did a few people participate but receive positive gains and quality of life? Or was your impact or your effects restricted to only a subset of your intended users? That's the goal of implementation science and public health. And I do encourage all of you, if you're interested in learning more about this, to study more about the RE-AIM framework and how it might be applicable to your own work. I'll see you in the course.